Being part of CarePoint Neurosurgery here in Denver allows me to enjoy everything that Colorado has to offer. Be it hiking, enjoying time with my dog, cycling, or snowboarding, I try and get out in the outdoors as much as possible. Because I enjoy this so much, I strive to have the same sort of goals for my patients so that they can get back to enjoying their hobbies and spending time with their families as quickly as possible. My name is Arias, and I'm an endovascular neurosurgeon. I am a third-generation neurosurgeon. My first exposure to neurosurgery occurred when I was 6 years old, while my parents were completing their medical training in England. My babysitter had canceled, my mom was at work, and my father, a neurosurgeon, was on call. An emergency came into his hospital, and without any other options, he brought me to work and sat me in the corner of his operating room. What may have been overwhelming for some children inspired me. From that moment, I wanted to be a neurosurgeon, like my father and like his uncle before him. My father's uncle was the first neurosurgeon in the Dominican Republic. After a long academic career, he transitioned to public health, and in 2010, a trauma center in Santo Domingo was named after him in homage to his long-standing service to the country. I have traveled to that very same hospital complex in Santo Domingo to operate on children that suffer from hydrocephalus. Hydrocephalus is a condition where spinal fluid builds up in the brain, causing increased pressure and head size, and can lead to significant disability and death. Access to care and proper equipment is limited in the Dominican Republic. With the help of various charities, my colleagues and I provide care to children who would have otherwise struggled with this condition for the rest of their lives. My residency training also included another international experience, where I served as registrar in neurosurgery at Beaumont Hospital in Dublin, Ireland. Beaumont Hospital provides public neurosurgery care for approximately 3.5 million individuals in Ireland. The socialized public health system in Ireland functions differently than our system in the United States, with a greater emphasis on primary care and less patients receiving surgery. This experience taught me to be conservative with some surgeries, relying on medical and less invasive options. But it also led me to appreciate the advanced level of care that is available only in the United States. The desire to provide the absolute best care possible led me to complete my training with a fellowship in radiology. When dealing with blood vessel disorders of the brain and spine, traditionally, neurosurgeons offered open surgical options, while radiologists offered less invasive options by accessing blood vessels in the hip or wrist and working from the inside.
The two areas of his primary specialty are very unique, to be honest. He's trained in open vascular treatment of complex neurosurgery, but he also is trained to do the same type of procedures by going through the blood vessels on the inside of the vessel in a less invasive fashion. And there's not a lot of neurosurgeons that do both of those things.
On the 19th of January of this year, I was at home on my computer and I had a stroke. The way that Dr. Arias handled that whole first, I'll call it interview, just gave me a tremendous amount of confidence in his ability to open up my skull and go in and repair my brain. An AVM is a hemorrhagic stroke, so there was hemorrhaging in my brain, in the parietal region. And it was on my left side of the brain, so it affected the right side of my body.
Our goal was to remove the AVM as quickly and safely as possible before it could bleed again. That way, we could preserve the function of the brain surrounding where the hemorrhage had occurred. With the special equipment available at Swedish Medical Center that's not available at any other facility, we were able to safely take care of the arteriovenous malformation without damaging the surrounding brain.
It was just an amazing recovery from that standpoint. I was so satisfied with Dr. Arias from the time that he first walked into my hospital room till all the way at the end after the surgery, and I said, okay, I'm done with all questions but one, and that final question is, are we done? And he says, we are done.
And when he agreed to come and join our group, that was a home run for us, and to be honest, a home run for the city of Denver to be able to get that kind of a quality surgeon here.